I worked full-time at one point in a residential elder care facility. So being able to interact with people face-to-face and hands-on is something that I was looking for moving forward. So when I heard about the MA program, that's what really drew me.
This was really a great stepping stone for me. I feel like it was a great way for me to discover if this was a field that I really wanted to be in, which I do. So I really like it a lot. I'll get our patient list ready for the following day, and then as patients come in, I'm the first one that they see. And I bring them in and I do vitals, so I do blood pressure and checking oxygen levels and temperature, trying to think, heart rate, and then I get a little information on what's going on. If they come in for a head cold, what are their symptoms? So I'm the one that gets all the information, and then I tell my provider, and then he'll see them.
I love it personally because a lot of people don't like going to the doctor. They feel anxious, or their blood pressure might be going up. So I usually sit and talk with them and just treat people like family, and it makes them feel better, and then they're more calm and ready for when the doctor comes in.
There's a checklist, so they make it extremely easy for you to follow the steps. Basically, it was filling out the application. And I believe that I wrote a small essay as to why I wanted to get into the program. And then it was a lot of gathering my medical history, my vaccination history. And then I finally met with them, had an interview. Then I was accepted into the program. And then classes started, I think it was the first week in September.
The program consists of pharmacology, biology, medical terminology, and computer applications.
Once you got past like the first couple weeks, and it was like, oh, this is getting easier and easier. A lot of homework. I mean, you have to be dedicated to it. Last class that we took was clinical, so we had 3 weeks of clinical, learning how to take blood pressure, temperature, respiratory rate, and then we started here. We did a rotation for 2 weeks.
Everybody in my class, it's like a sisterhood. We still speak, we still get together and talk and check in on each other. It's great. So the classes some of them were pretty tough. It's definitely, you need to be focused. You need to make sure this is what you want to do. But they were fun, and they were interactive, and it was informative.
Ended up being diagnosed with early stage breast cancer in October. I was a little bit stressed on how I was going to deal with that, and I felt a little bit bad because I felt like my time for treatments was running into my work time. And the reception that I got from not only CCV but BMH was amazing. They relieved that stress for me. So I feel that anybody that is wanting to join into the medical field and they're considering this program, they are going to get the best treatment. They're going to get the best treatment from CCV, and they're going to get the best treatment from this hospital, from BMH.
Because you get to see how each place does things, and everybody is amazing at teaching you how to do things the way that they need it to be done for their providers. So I can't say enough about the whole thing. I loved that personally.
I love every day. I love coming to work, and I love the fact that I can say I love my job.
Do it. It's worth it. You'll be happy.